All right, welcome back to the Elias Macco Show. This week, if you can believe it, this week marks 5 years since the World Health Organization declared COVID-19 a global pandemic. Now, ladies and gentlemen, I want to tell you something. The last couple of years on this show, we basically had a rule. No talking about COVID-19. I mean, like the last 2 years, like, okay, it's enough of people coming on and saying, well, COVID-19, like the last 2 years we've said, okay, enough's enough. Just for a moment, we need to regain a little bit of our sanity. I'll just be honest with that. And I want to take you back to 5 years ago. Do you remember 5 years ago? Here's Jason Mayoff, a newscast. Do not adjust your sets, ladies and gentlemen. This is a Jason Mayoff newscast from 5 years ago. Remember this?
In the news, some major cancellations today because of the new coronavirus. Start off with sports first. The NHL announced in the past hour that it is pausing its season, starting with tonight's games. Earlier today, Major League Soccer said it is suspending its season for 30 days. And last night, the NBA said it's suspending its season until further notice. Major League Baseball, which is in spring training, is expected to do the same. Also, the St. Patrick's Day parade in Montreal has been canceled. The United Irish Societies of Montreal put out a statement.
So, ladies and gentlemen, do not adjust your sets again. That's from 5 years ago, okay? So this weekend, we are going to party at the St. Patrick's Day Parade, but that's the flashback. Are you having flashbacks right now? That's what we were going through 5 years ago. And then if you'll recall, right here on CJAD, you know, it became everything we talked about for a year, maybe even 2 years, for crying out loud. And one of the voices during that pandemic, helping us all get through it, was Dr. Vardit Ravitsky. She used to join us on the Big Five. We used to do segments with her, and we said, you know what? Let's go back to Dr. Ravitsky and have some sober second thought on what we went through 5 years ago. It's our pleasure to welcome back to the program, after a long hiatus, I should say, Dr. Vardit Ravitsky, who is now, and this is the thing about this show, you come on this show, big things happen to you. She's president and CEO of the Hastings Center. It's a nonpartisan bioethics research institute in Garrison, New York, and a bioethics teacher at Harvard Medical School. Dr. Ravitsky, welcome back.
Thank you. It's so exciting to be back with you.
How do you view 5 years ago?
First of all, Elias, come on, be honest. Don't you miss the masks? Don't you miss the closures?
I don't. Yeah, you know, listen, I'll say this, and this is why I view it like, you know, I think it does character build when a society and people go through something together. And whether it's a pandemic and other things. So, you know, to say in my life, okay, I went through something, I do look back on that part fondly, but I'm not, it's, you know what, to be very honest, I believe like, especially years 2 and 3, we kind of lost our minds just a little bit, but I don't know how you view it. How do you view it?
I have to say that the main lesson is not about what we did at the time. I think all those measures, you know, asking people to put on masks, asking people to stay home, those cancellations that you just played, these were appropriate reactions at the time. There are 2 areas where I feel we failed and need to now learn enormous lessons for the future. The first one was with how we communicated with the public, and you played a huge role in that. You know, you said for over a year, that's all you talked about. You brought in all the experts. You tried to disseminate good information, encourage people to do the right thing. So you made a huge effort. All of the media, all of us professors and experts, we all tried, and I think we could have done much better. And the main issue was that the evidence was changing. In the beginning, that day that you played, we didn't know that it was airborne. We didn't know that you could infect other people before you had symptoms. We didn't know how far you had to be from other people. Then we didn't know if we would have vaccines. Then we didn't know if the vaccines really have side effects. We did not know. And we should have been more transparent about what we didn't know. We tried to sound like we know in order to make everybody feel safer and encourage people to do the right thing. We should have communicated better that science is an evolving thing, that public health rolls out in an emergency without having all the information, and that we're all doing our best.
You mentioned 2 things. Let me let you say the second thing you want to highlight before we broaden the discussion. What's the other thing you want to highlight here?
The other thing is that I think the public health authorities, public health community assumed that we all share the same values. It's all about preventing death. It's all about preventing suffering. It's all about keeping the hospital system functioning. Remember, there was a time in New York there were trucks with coolers outside the hospitals for bodies because the morgue could not accommodate the dead. It was really horrendous scenarios. And in light of that, crazy reality, we thought, obviously everybody shares the same values. But what we discovered after, a few months was that no, other communities had other priorities. People cared about economic sustainability. They cared about their kids going to school. They cared about grandparents not being isolated. It wasn't for everybody exactly the same agenda as it was for public health. And we should have listened more. We should have listened quicker.
And, to me, again, like health emergency happens, pandemic happens. To me, it was the longevity of the affair, right? And I know some people always like, there's conspiracies from the media and government. And I always laugh, if there was a conspiracy from the media, what we would have been doing is like, everyone get out, keep going to restaurants, keep buying stuff. It killed us in the media, lack of advertising, all of that stuff, okay? So we actually acted not in our best interests by going with the public health information nonstop. So I like to push back on people that say media was part of a conspiracy. But at the same time, I look, again, not year one. I'm like, year one, let's be tough. Let's, it's a health emergency. But year two, I look back, my mom, she passed away of ALS during the pandemic, right? And I think about the times I didn't go see her or we didn't do a family event. We were worried about that kind of stuff, missed out on that. Again, year one, it was tough. But I think we should have eased off on the gas a little bit there. And then, of course, we're washing our groceries and we're following arrows in the pharmacy as well. So, yeah, I don't know if there's anything else you want to add here on what I just said.
You know that I'm sorry for your loss, Elias. I communicated that personally. Yeah. And so many people are having the same feelings and thoughts that you had. We missed out on things that we'll never get back. So your point is so, emotional and visceral to everybody listening. I think now it's all about the next pandemic. Uh-huh. The next pandemic will happen. Are we learning? Are we listening? Are we preparing reactions that take into account that we will not know everything there is to know about the new virus that will come? It will come. Mm-hmm. There's no doubt about that. What lessons have we learned? How are we preparing better? How are we communicating better? And a part of it is what you said. How do we evolve on the best timeline, not just in the best way? So I'm totally with you on that. Great point.
And you make the great point off the top, right? That we didn't know everything, right? Like there was a lot of stuff that we didn't know when things started. Do you look back on stuff where actually we did know and we still did the wrong thing? And I'm just wondering, and maybe not here in Quebec, I think we can be proud in Quebec. Our kids stayed in school more than most jurisdictions in North America. That was a big focus of the Quebec government, and we paid the price by lockdowns and curfews, But like when we look back, it seems like we did know even early on that young people weren't as affected, right? Like children and teens, they weren't being affected like older people were. And we still treated almost everyone the same. Are there some things that maybe you think, we did know and we made the wrong decision?
I think we lingered maybe too long. Again, your point is excellent. We could have moved faster as we learned. Mm-hmm. Now, this mantra that some places had, like Quebec, schools open, open the schools, close the bars.
Yeah.
And that was Quebec's approach. That was definitely the right thing to do because kids paid a terrible price and mental health paid a terrible price. So I think one thing to take into consideration better next time is the impact on children, the impact on families, and the impact on mental health as we're surviving, what is a physical assault to our society. Something like, let's make the adults pay more prices and the children less prices. That was something that definitely should have been acted on. Quebec, you're right, can be proud of itself, but not all places reacted the same.
As we wrap up here, you're talking about, this is about the next. Do you have faith that we won't have a bad taste in our mouth because of what we went through 5 years ago? Do you have faith that we'll be able to handle the next one better?
No, I don't, because I think the saddest thing to me in all this is that the pandemic, rather than increasing the trust that the public health, that the public has in science, in vaccines, in expertise, the pandemic actually reduced the trust that the public has. So I think the next time it will be an even harder battle for any kind of public health messaging to reach and to have impact. And that is maybe one of the worst outcomes of this pandemic. We started it with a crisis of trust, and it only deepened. So how are we going to convince people to make sacrifices when they look back and think, many of them, unfortunately and falsely, think that they were misled last time? That is one of the things that scare me the most.
Dr. Ravitsky, it's great to hear your voice. You have a tremendous voice, by the way. I loved hearing it 5 years ago and love hearing it this morning. Thanks for coming on.
Thank you so much.
That's Dr. Vardit Ravitsky, President and CEO of the Hastings Center. It's an independent, nonpartisan bioethics research institute in Garrison, New York. Also teaches at Harvard Medical School.